Hi everyone, this is Almeen from Dental Chic. I'm an oral hygienist and today I'm going to teach you how to clean your teeth. The first thing you need to know is that plaque, which is the culprit behind all oral things that go wrong like gingivitis and tooth decay, is different from how we imagine it. It's not a very hard substance, but it is quite sticky because the bacteria in our mouths creates an adhesive so that they can stick to the teeth. So I'm using Ponal today to do a little demonstration because I have noticed that my patients use medium and hard toothbrushes and they do a lot more damage than any good. So in order to show you how plaque behaves when you use a certain type of toothbrush, I am spreading some wood lime onto this piece of glass. And then I'm going to show you that with this medium brush, when I brush over it like this, what it looks like and how much it's leaving behind. Then this is my super soft brush, and when I use that, it removes a lot more. Can you see there? Obviously, it hasn't removed everything, but that's why we have to make more than one circle or rolling stroke at each tooth. So, to start off with, I find that a lot of people, apart from using a medium or a hard toothbrush that does not properly remove plaque, they also use an aggressive scrubbing method, which is very bad for the gums. So the gums are very sensitive. If you use a medium or a hard brush and you use an aggressive scrubbing method, the gums start receding away from the tooth neck. And then the neck is exposed. The neck is much softer than the crown. So if you continue to scrub there, you'll start scrubbing little trenches into your tooth necks. So when that happens, the underlying dentine starts showing through and people think that it's dirty, so they scrub even more, and then it's a vicious circle. It also causes sensitivity, which can be really, really unpleasant, and it's not really a reversible condition, so we want to stop it before it gets too bad. So when you brush, either make large soft circles over the tooth and the gum, and then you count 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Soft circles over the tooth and the gum. Or you can do the rolling stroke, which I use. You place your brush at a 45-degree angle and then you sweep downwards. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You're making your at least 5 circles or strokes at each point. And then here where we chew, this is where we get cavities the easiest. So there you can do a good solid 10 to 20 scrubs. 10 to 20 scrubs, and then either circles on the inside or still your rolling stroke, at least 5 on each tooth. And then you're going to do exactly the same at the bottom. So now if you're in a hurry, maybe you can do your circles, or if you have time, you can do your rolling strokes. Rolling strokes are much better because they do not irritate the gums. They don't cause recession. Recession is when the gum recedes. So then they don't cause abrasion lesions, which is when you start scrubbing into the tooth neck itself, which can be ugly and painful. So this is a quick lesson in how to brush. Then we get to floss. People don't really understand floss. So floss, how it works is, it's not about food getting stuck between your teeth. It's about plaque going in between the tooth and the gum. microscopically. So it causes gum disease very easily. And the first sign that you see is blood. So when you brush or you floss and you bleed, then you know that you have gum infection. That means you have to clean better, not that you're hurting yourself and you should stop. So when you floss, you go in between two teeth. You make a C around the one tooth and then you wiggle it underneath the gum a few times, as deep as you can. And then you make a C around the other tooth and you wiggle it. It's the same motion that you use when you're drying your back with a towel. So I am going to show you on my own teeth how to floss. Go in, make a C, and you wiggle it under that gum. Wiggle, 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 wiggle. And then you make a C, and then out. It's very quick if you do it every day. It's not difficult if you practice it. And you can dodge quite a few bullets by flossing, because if you don't floss, you are going to develop a chronic gingivitis. That gingivitis can go into the bone and then start eating away at the bone, and then your teeth become loose. And I see this all the time. It's not a painful condition, so people don't even know that they have it until I inform them. So flossing removes the plaque that causes that problem. Certain people are more susceptible than others. Smokers and diabetics, they can very easily get this condition, which is called periodontitis. We are going to talk about periodontitis in a later video. So then people ask me about the water flosser. Now, I like this gadget, but I do not believe that the word floss should be in the name, because nothing replaces floss. Nothing can do what floss does. So even if I show you here how this, it's literally not really doing anything. It is very good at removing debris. So pieces of food, if you have braces or a bridge or an implant or crowns, very good at removing that stuff. But it does not replace floss. There's also something on the market called an interdental brush that looks like a tiny bottle brush that you can push in between your teeth where you have large gaps or crowns or implants or bridges. That's also a wonderful tool to clean your teeth with, but it still does not replace floss. Floss every day if you can. It really starts getting to become part of your daily routine, and it's actually quite quick and easy if you do it every day. Remember that it's all about mechanical removal of plaque. If you can remove the plaque in your mouth successfully, you will never have issues with your teeth. Mouthwash does not remove plaque. It is just a tiny chemical boost to help when you have infection. And if you do have an infection, you can also use a salt water solution. Cup of warm water, teaspoon of salt. You can even add a little bit of bicarbonate of soda. Make sure that it dissolves. Don't brush your teeth with bicarb like that. It's not going to whiten your teeth. We will be discussing bleaching of teeth in a follow-up tutorial. Let me know if you have any questions or if you would like me to discuss anything in particular. Bye!